I'm Brian Little and I come from Moorfields Eye Hospital in the UK, and I've been doing cataract surgery for the last 35 years, which has changed dramatically in that time from when I started, which was really with extracapsular surgery, through the development of phaco and then the more sophisticated developments in instrumentation and techniques that have occurred over the more recent years. There have been a number of trends in the surgery itself. The surgical techniques that are now available are certainly more sophisticated than they used to be. The phaco machines themselves have developed into sort of fourth generation machines, so there's much greater possibilities for exquisite control of the microenvironment inside the eye, which makes for safer surgery, particularly with the fluidics and the power delivery, which has been modulated, so there's lower temperature phaco that we're performing, and then with the lenses themselves that have increased in sophistication and precision. Toric lenses, which are used to treat astigmatism, and multifocal lenses and multifocal toric lenses that have become available, so that you can end up actually these days not giving patients the vision that they had before surgery, but vision that they're better vision than they've ever had in their life. The instruments themselves play an absolutely critical role, particularly in more complex surgery. In basic phacoemulsification, the instruments are quite limited, so the second instrument is about all that you will be using, and the blades to make the incisions, or the laser if you're so inclined. But the more sophisticated instruments really come into their own during complex surgery, so that I do a lot of that type of complex surgery, where there have been complicated issues in the primary surgery, where there's been vitreous loss on your dialysis, damage to the iris, etc. So when you're doing things like suturing iris, for instance, you need sophisticated, very precise anterior segment instruments in order to perform these procedures safely inside this very tiny microenvironment where you have to manipulate tissues, suture them, etc. And these instruments are indispensable. I've had a lot of experience with MST instruments, which started when they started, really. I noticed them, I think it was at the ASCRS or the AAO many years ago when they first started out. And they had a limited selection of very high quality instruments, which caught my attention. And I am particularly interested in the engineering and the development of new instruments and in their design. And they'd relied on the advice from many experienced sort of key opinion leaders in surgery to develop their instruments, so that they actually had listened to the users and come up with designs of instruments which much better suited the needs of surgeons under the conditions where going to be used. Yes, I have used many of their instruments. The ones that I particularly use very frequently are the anterior segment scissors and their micro-grasping forceps, particularly for iris iridoplasties and iris suturing. The other instruments that I use are the micro scissors for cutting capsule, which are brilliant in, for example, where you've got a fibrosed, scarred capsule that's puckered, and it's impossible to tear it by conventional means. The use of the curved anterior segment scissors are indispensable, because you just get exquisite control and you can perform the surgery safely that you wouldn't otherwise be able to do. And the instruments fit on the handle, and to me the handle is a very important part of it, because it's a squeeze action handle, and there is a design that the MST make, which is a 360, called the 360 handle, which means that your grasp on the handle of the instrument remains static, so you don't have to change your hand position, but you can change the position of the instrument relative to your hand by just rotating the collar on the 360-degree handle. My experience with MST is nothing but positive. I have found them thoughtful, they are responsive, they design instruments of unusually high quality that are more fit for purpose than I think most other types of instruments that are manufactured today. I think they're an excellent company.